let's get started. We've got a smaller group today with folks who are traveling either for extracurriculars or just for the Memorial weekend. So we'll keep things on the shorter and sweeter end with preparing and discussing healthcare interviews, discussing the schedule and plan of final interviews, and then giving you a good chunk of time either to work with your partner if they're here, or if they're not here, to work independently on developing your final interview presentation for the class. So last class, we talked about counseling interviews. Interestingly, there was a trio who was interested in working on those. So I went ahead, and folks who had that as their top preference are in our group of 3 for this one. So we'll have that type of interview represented in our final interviews in the class. Looking forward to those. We also took some time to talk about some of the steps involved in the process of doing counseling interviews. And then we discussed some of the challenges with developing a level of comfort, understanding, and a positive relationship between parties in this type of interview. So as you might remember, right, counseling interviews are about guiding, helping, listening, and providing support. It doesn't necessarily mean you're a qualified mental health expert on certain topics, but it does mean that if an individual is faced with a crossroads, a problem that they're trying to navigate, that you're taking on the role of interviewer, of using your line of questioning, not necessarily to dictate your own idea of what they should do, but to help the interviewee discover what they want to do. And questions, particularly open-ended ones, can help in developing that process. So we talked about the ways that you utilize more open-ended interview style, building rapport, building a strong connection as a means of engaging this type of interview effectively. So for today, I want to take a moment just to talk about the final interview partnership and schedule so that you're on the same page about what things will look like as we go into the end of the term. And then we'll talk about healthcare interviews and give you the chance to work with your partner. So I posted, for today's class, I posted the final interview schedule. I did so. There's a lot of moving parts that I was trying to consider here. First of all, accounting for the schedule restrictions you sent me in that first Google form, accounting for your preference for type of interview. I was able to basically give just about everybody their first choice. Also was trying to shuffle around the dates relative to your other interviews and shuffle around the partnerships so that you are ideally working with somebody new. So a lot of moving parts. Please let me know if you see any issues with your interview. Particularly, you know that it's on a date that you can't attend, so that I can make sure that I'm correcting that for you as soon as possible. So for a lot of these interviews, for instance, a performance interview, right? You're not necessarily in the job that you're receiving a performance interview for. So this can be something that, you know, is fictional or is assumed. Some of you did this already with the job interviews where you were talking about a certain kind of experience that you didn't quite have yet, such as going through law school. So you can do something similar. I just recommend that you clear with your partner what that experience is that you have and what you're intending to convey in that interview. And then, just like with the job interviews where you were both able to apply for different jobs, right? You can have different scenarios. For example, a counseling interview, you might have different problems that you're discussing with your partner. In a persuasive interview, you might be convincing the other person to do very different things. So you can definitely kind of change that around based on that interest that you particularly have. So the partnerships, again, posted to Canvas. These are going to start Wednesday, the 31st. So as a reminder, right, you get the long weekend. We don't meet on Monday for Memorial Day. So today is your main chance to work with a partner in preparation for these types of interviews. That way, you can think ahead to the interview date. So on Wednesday, we have Angela and Shade, Thomas, Natania, and Kai and Mark, performance and healthcare. We have Britt and Luli, Drew and Blake, Austin Addison on Friday, June 2nd. And then again, we have our trio, Gabriel Ferris, Malachi and Brock on persuasive. And then Wednesday, June 7th will be our final set of interviews. We did a poll last class, and the overwhelming majority would rather have last interviews for that Wednesday so that the Friday, you know, was more kind of freed up for you to finish up and do finals for other things. So that works for me. I will say, again, there's a very good chance that We might be using the class meeting on Friday, June 9th for one of our candidates who is for a new faculty position at UU. So I'll keep you updated about what that might look like and what class might look like for that day, just so that you know what to expect going ahead. So again, just double check your partnership and the type of interview that you've been assigned. The majority of folks were either interested in performance or persuasive interviews, but we were able to kind of round things out and make sure that all 4 types of interviews were being represented. So if you didn't complete the form or indicate a preference, I just kind of slotted you in a way that worked best for the group. All right. Any questions on that before we start? Great. So for today, we're going to talk a little bit about healthcare interviews. I'm going to show an example here in just a minute, talking a little bit about the healthcare interview process. This is a type of interview that has, again, a pretty close relationship to counseling interviews, right? Because obviously, mental health support is a pretty big part of healthcare and navigating the healthcare system. But this does take a more patient-provider type of perspective in terms of offering support and guidance for people in need of care. So one of the key ideas here of this type of interview is a focus on patients, right? So healthcare interview is promoting patient-centered care. It's focused on solving a problem that the patient is encountering. And again, this could be related to mental health, but oftentimes this might be physical health related concern too. For example, I've had folks in this class before who've done a healthcare interview and they say, I've got a broken arm and working with the provider on receiving care. I'm teaching communicating health and science online this term. This is a course I've taught before. We'll teach again. We talk a lot in this course about how patient-centered care is a really crucial and important way of promoting and engaging with the needs of the patient, right? Because oftentimes we think about the role of autonomy and decision-making on the part of a patient, the patient making an informed and engaged decision about what they're doing about their healthcare, right? Provider has to follow the Hippocratic Oath, do no harm. And so provider can't unilaterally provide some type of treatment or care that doesn't have a directive from the patient in many situations like this one, right? Obviously, there are emergency situations and contexts where they are providing care. But most of the time when a patient is agentically trying to resolve an issue or seek care, they're ultimately the ones who are making the decision about their own care, right? So one thing that's helpful from the perspective of the provider is to empower the patient to understand the various options and decisions that are available to them, the risks associated with their decisions, but ultimately to let the patient make their own decisions about how they're going to move forward, right? Again, similar to something like a counseling interview, it's not necessarily the interviewer's job to say and prescribe what thing they should do, even though they might strongly encourage the patient toward a particular option, as much as it is giving that information, right? Sharing control, again, kind of this trust fall where the interviewee is disclosing, sharing their own information, but the provider or interviewer is also, exhibiting some level of trust for the patient in their decision making. Again, also in a lot of healthcare settings, there's distance, there's challenges in navigating this relationship, particularly when patients don't necessarily trust their providers. A lot of people mention, they have a telehealth appointment, it's very short. Providers are oftentimes scheduling a lot of appointments with a lot of patients, so it can be difficult to feel like there's a meaningful conversation in a short period of time, oftentimes hovering in that first tier of communication and disclosure. So there are a variety of factors to consider here with regards to how to engage in something like a healthcare interview. So one thing that's talked about a lot in the field of health communication is the importance of culture, right? What we consider to be healthy, what we consider to be a representation of our values and beliefs as they manifest in the healthcare system is going to look really different. One really good example of this is looking at disability communities and or deaf communities, right? So in many deaf communities, there's a lot of discourse surrounding cochlear implants where if they're placed in the ear for many people who are deaf, right, it allows them to hear. And for members of some cultures or groups, cochlear implants, you would think, oh, this is a great positive thing. This is providing support, allowing deaf folks to hear. However, In many deaf communities and cultures, right, deafness is a key component of cultural identity. For example, Gallaudet University, right, is a deaf college that provides, support and connection, the development of American Sign Language is an example of the development of deaf community and culture. So cochlear implants for many deaf activists and members of these communities is seen as destroying the culture. So what is considered to be healthy or normal, right, is not a one size fits all. It's dependent upon culture, values, and beliefs. I don't mean to reduce to dualism, but we do also know that there are differences in how conceptions of medicine and health have developed in more Western cultures like the United States relative to more Eastern cultures, right? Where the sort of Eastern approaches to medicine have emphasized a much more holistic view focused on body and mind being connected, whereas in more Western cultures like the United States, we talk about cancer and we talk about it being like an invasion from this outside force, and we have to stop, or we use metaphors, right, to kill, to destroy, to beat. War metaphors get used a lot in Western cultures to describe health too. So one of the challenges in navigating healthcare is to navigate the types of choices that make sense as we consider the differences across cultures and the ways that different cultures might choose to communicate about issues. And that means, recognizing and supporting diversity as it comes out in a variety of contexts. If we consider, for instance, age, a lot of more elderly patients feel as if they're infantilized, talked down to, and there's assumptions about their mental faculties that might be unfounded. Again, with regard to race, one historic example you might be familiar with is the Tuskegee syphilis study, right, which withheld treatment and support for Black participants in the study, and there's been significant distrust and challenges and racial disparities in the healthcare system. We think about gender, there's some really significant pieces that have talked about some of the ways in which, in particular, women have experienced challenges in credibility and being trusted by a provider to understand and talk about their own experiences, right? If we think about the history of healthcare, we know that women were disproportionately institutionalized under a catch-all diagnosis of having quote unquote hysteria, right? So we know that there's a lot of challenges with regard to gender in the healthcare system. Again, we think about this in the context of current debates surrounding abortion. So there's a lot of differences here. And then both culture and stereotypes also play a role, right? We don't want to assume based on somebody's, demographics, race, gender, and so on, that they're going to behave in a certain way. In fact, a lot of kind of healthcare interviews have benefited from things like patient intake forms, which allowed for folks to, for instance, disclose pronouns prior to an interview so that there's not a misunderstanding of who a provider is interviewing. So kind of helping to develop and enhance the climate, right? Making the climate feel comfortable, supportive, especially in working through a difficult issue is important. Again, rapport, developing a meaningful exchange between people really matters. And also considering both physical and emotional barriers that can impact the process. Again, if it's telehealth, that can be a pretty big barrier. Oftentimes, right, there's a challenge in discussing issues of health and issues that are personal. Sometimes people are very private and they find themselves in a setting, right, where they're talking about, a very kind of personal healthcare issue, right? If you were discussing, something like prostate cancer, that can be a challenging thing to bring up in a setting where, a doctor is knowing a lot about your body that you would otherwise choose not to share. So some issues that can happen in healthcare interviews, right? So one issue is that while we do want patients to be informed, sometimes the information that patients are coming in with is not necessarily, useful or helpful for the particular issue they're dealing with. For example, somebody says, I read this study that if you eat this superfood 3 times a day, that means that cancer will just go away, right? And sometimes we have to consider the role of kind of false information, pseudoscience that can impact the information that a patient is drawing from. Again, we've seen this a lot in the context of COVID. Communication breakdown occurs when there is just this lack of trust between the patient and provider, right? They're no longer able to engage with each other meaningfully, and a lack of persuasive and predictive solutions. So here's this problem that you're dealing with. I came to see you to help me figure out options. You're not really providing any options to me, right? Even if the options are just to be comfortable, to acknowledge that there's no treatment for something, but there is a path forward. A solution at the end of the interview is something that typically somebody in a healthcare interview wants. So some strategies that can be really useful in terms of promoting effective healthcare interviews. First of all is, again, focusing on collaboration. One way of thinking about this is that the interviewer and interviewee are a team, and their goal as a team is to develop a strategy and plan to support the interviewee and the challenges that they're working with. One other strategy that tends to work really well, again, is this idea of self-persuasion. This comes up again in counseling interviews. It's the idea that the interviewee is ultimately being convinced through their own discussion and through their own information what option works the best. Having talked about it, I think it's a really good idea for me to go through with this surgery. You've been really supportive, and this gives me a sense of what I can do next. And again, this allows the patient to really feel like they've engaged in a lot of different options and pick the option that represents their values, their beliefs, their concerns, as articulated by the interview process. I wanted to share a video example that goes over some of the steps related to a healthcare interview, and I think some ways in which good, effective line of questioning can really help the interview style develop.
Yes. Harris, I'll be your doctor today. Let me just wash your hands real quick. Would you prefer Miss Melanie or? Oh, that's fine. So that, is there anything else besides your headache that you can address here today for clinic?
Just that it's a very concern that we can't insurance companies. I'm not sure this is going to be covered yet.
Right. Is there anything else? What we can do is while we're talking and I'm doing history physical, I'll have my office secretary look at the insurance plan that you have.
Alright.
So you don't have to worry about that. Okay, sounds great. Is there anything else?
No, this is just really bad.
Okay. So what I'd like to do today is let's take a look at what's causing the headache. I will go over history physical, and then we'll do again the physical exam, and then we will look at your insurance policy and make sure that's all okay. And I think that's all good.
That's good.
Perfect. So tell me a little bit more about this.
Well, it started about 3 days ago, and it just made me flat. I didn't work. It's nothing's helped. It's all over. It's really bad on the nose, so trying not to move too much, and the light is bothering me.
Unfortunately, I can't dim the lights in this room, but still okay. I'll try to go quickly, and it'd be okay if I took some notes.
Sure.
All right. So you said this headache started about 3 days ago. Okay. Was there anything that brought it on? Anything unusual that happened maybe 2 days ago?
Really, no.
So I think what the opening of this interview in particular shows really well is how assessing the concerns and level of comfort that the interviewee has sets the stage for the rest of the interview. One thing that we learned early on, right, is the woman who's experiencing the headache is not just worried about the headache, she's also worried about insurance and getting things covered through insurance, right? That is a concern that she would have persist throughout the entire interview unless the use of an open-ended question in the beginning, wasn't given to set the stage and allow her to express that concern. There's also this concern about the lights, right? And the lights contributing to the headache and just showing a level of concern, right? I can't dim the lights, but we can move through this quickly so that you can be supported. So showing an understanding of the issues that are impacting somebody before you dive into the nitty-gritty of what it is they're experiencing, the challenges that they're navigating, can really help the patient to feel supported and comfortable in that process. So a good example here of how you can use the opening and framing of the interview to show care and support and kind of get into the topic in a way that helps the patient feel comfortable and supported. So, given that, and given some of the ways that we have developed and talked about the healthcare interviews for this class, I just want to give you the remaining time to work with your partner or to work on your own. If your partner isn't here, you can also reach out to your partner, send them an email or message to help as you're preparing. If your partner's here, I'd encourage you just to introduce yourself and exchange some contact information. You might otherwise message your partner on campus. And for attendance, I just ask that you develop at least 3 questions that you could ask your partner for these interviews that you can email and pass to me. And then you can use the remaining time, the remaining half hour or so that we have as you see fit. You can stick around and continue to work with your partner, continue to work on your own. Or if you have other responsibilities and like to head out, you can also do that. So take some time to chat with your partner on this. And then work on just a couple of questions to send to me, and I'm welcome to continue working or to head out. So if you are Wednesday, May 31st, raise your hand. Okay, and take a quick look around to see who's here. Friday, June 2nd. Wow, okay. Monday, June 5th. Okay, some of you here, and then Wednesday, June 7th. Okay. All right. So take some time to think about, prepare, and to develop some questions. Again, you can also develop or send these questions to your partner if they're not here as well.
Oh, you're not, he's not here.
I kind of just ignore everyone. So. Yeah, I just feel like nothing, so you can get rolled out. Well, that's a good. I can't even do that because that's what they're for. So that's, even so what were you? So I can do that to be on future.
If you're interested in doing like mental health counseling or something, I'm fine with whatever. I'm not bothered.
Or should be, you don't know how, that's okay.
Yeah, but I guess it depends on how much specific hours of you should be the type of mental health counseling that you can.
You know, like hours.
If that's like,
That's right.
I'm talking about specifically what you want to be interview something about. Cause like, I don't feel comfortable with somebody doing a mental health one when they don't have good like background on it and then spread misinformation on that kind of topic. So that would be my only concern on it. That's like coaching, even though I'm interested in, like, I don't feel comfortable. Yeah, I don't feel comfortable being put into like a professional that just is unethical, like for me, for myself. And so I'd probably do something like you're having trouble with like solutions to other like mundane life problems. Like, oh, I need to move this thing. Or like, for grad school. You're trying to figure out how to transition. Situation. think that's probably a fine one, like I'm moving for some reason. And
Yeah, probation, all of these.
yeah, so. This is good. It's gonna be funky. Yeah. Good question. So I suppose we make a lot of on the ones that thanks.
Oh, yeah, you just, yeah.
Yeah.
Okay. No, no, I don't. It's very. Like,
We are.
oh, yes, I really also. Oh, yes. I'm finding the first day. The other stage, but yes. Second to the first day. So part of it is starting to be. Yeah. You can see yourself there.
One, you can interview with the already. And then that would be like.
I didn't, I just passed. Someone in the interviews.
Yeah, Garrett.
Cool. Parents not in the same.
Yeah, that's why they're very.
Oh, we just recruited, Jacob.
And so he would choose what he was comfortable with, and that's he would say like. Because he's not necessarily. He's going to. Even though I'm not. You said you want to do.
Well, I said I do it. Yes. Yeah.
So what kind of interview would you like to do?
I don't know if they're doing that. The trouble is,
Because I was under the impression that you wanted to do that as the. Like, as you asking questions, but.
Well, I feel like it should be up to
Yeah, but I think the specialized interviews and maybe the people choose something that they're interested in and you like them, so. I would personally say choose a couple that you'd be interested in. And then see which one of those options. You're okay, because it doesn't, if the interviewer chooses, then the interviewer is really learning about what they want to learn about, you know. Then I'm gonna just that out and all. Yeah, it's the past. It's a third. Sage because of our situation and what we should find minutes, we have to take the other one right now. Yeah. Which means right now I'm taking both tests. I took one last time. Right. Yeah. It's good. Oh, into the like some bullshit, like something, you know, exist and then we'll pick it up on Wednesday. Although we don't. Yeah, so that's a good question. By that. So in that case, you'll probably be there because I'm not a sports person, so I don't know that I could answer questions on that. So that would mean that it's something. Yeah, I'll send you my interview evaluation system. Well, no, I will send you. Yeah. Right, I don't think there's much else that I can figure out. Yeah.
Of the day. Thanks.
Stay. No, I would stay for like 2 more seconds. I don't know. I don't have to face the question. I don't know if parent wants to do that. Always an issue. The basis of attendance, I just was like, dog. Yeah, it's, I mean, I don't mind being considered for that. It's not. Well, we should. I would. You could not be a part of that. Why should you be? That's fine, okay, yeah. I wasn't invited though. Wow. So they're the wonderful. You lift it, you walk to the water fountain, you lift it, and lift it. I'm like, yeah, you're smart, you get it. You get it. You know what you Somewhat problematic, but. You'll get it. Grandma's gonna be so impressed. No. I'm really bad. I find it like that's and what do you want to do?
Legally over here?
Or you just know that
I'm probably gonna have to do that. In my group too. Here's what it looks like.
I mean, you put all these stats, like, have you ever? Yeah, or have you ever on the type of. Yeah. And you'd be like, okay, well, this pet is different, and this is what it's gonna look like. Blah, blah, blah.
And see, interesting. Over here. That's so. My God.
That was a quick response. Right,
Hey, I've got extra time to look at these as I'm getting them.
That's true, sure. I did notice that. I was like, wow.
right, that's why.
Yes.
I don't sleep well if I don't have a clean inbox.
Same.
Same.
I can't really do it up like 4. Yeah. Number 4. Yeah, sometimes when we got a job and requests.
I check
it.
You check my email like 3 times a day. I have my idiot self with my facts. What do you do?
Oh, wow.
Very important.
There. I have to check out.
I could have solved it, right? Check out the things.
The lunch.
Oh,
They checked out, but no.
well, she must be.
They checked out at 9, and I didn't have the paperwork in the office, so I ended up in the office. And then I did the checkout call. That was the perfect time to do it. I don't really have any plans that I have close here. It was not just, they were like, "Well, can you get charged?" And I was like, "I don't know the good answer to that question." And they were like, "No," and I was like,
Just that.
"Well, valid, let me call my boss." Well,
No,
they didn't know they would get charged for using our house.
Oh.
No, they're not.
No,
They're
they-
not.
oh,
I think they already, they didn't have them.
I think, yeah, I thought the contract said.
I don't know. I think some of them guys, this never come about. So it's not.
Have a good weekend.
Yeah, you too.
So, and then probably. They'll get one. You may have taken the. I would.
I mean, obviously, I don't know what you're treating. But I think it's so funny.
Yes.
I just believe this is how I got my cat here. My laundry, I'm gonna go off, but she's coming this weekend, and that only gives me 2 days to get paper with this Sunday and have it. He's like, yeah, we'll set the meeting this Friday. Yeah, so, this week.
No, these trees.
Yeah, no, we get reading, you know, I think it's just because like, my mom is worried about my health.
I think it's happy.
Well, my mom legitimately texted me, I'm right back. There when I could bring her.
You're like,
I miss you. I'm not. It was like, oh. I'm actually not.
Sociology.
Sociology, that's not as horrible, but sociology stuff, anything other than like English and communication, that's horrible, so.
Not as being steady.
I know.
Nothing being exactly like.
That's why
I had an honor.
Hey, it's better than like,
I like sociology and chemistry. That's not a change.
it's better than bio, like
Bio and majors have it.
they scare me.
I have to take. They're in.
They scare me. Bye.
Yeah, have a good one.
Oh, I have a question about the extra credit.
Yeah.
What is it gonna be?
Oh, it's on campus.